Hello and welcome to Trending Health. I'm your host, Kevin Sylvester. On today's show, we're going to learn about mini dental implants, what they are, who they're for, and perhaps if they're right for you. And joining me now is our expert, Dr. Josh Dolin from the Morgantown Center of Mini Dental Implants to explain exactly what mini dental implants are. Doctor, thanks for being here.
Thanks for having me, Kevin. Appreciate it.
Morgantown Center for Mini Dental Implants. The name's kind of self-explanatory, but that's not all you do there. You have a general dentistry practice, correct?
Yes. So 18 years ago, I started my own practice in Morgantown, West Virginia. We do all dentistry, hygiene, general dentistry, all of the above. And also, around that same time, I started placing dental implants. So, we know that a lot of patients hate being shifted here, there, and everywhere to have their dental work done. So we wanted to kind of be that one-stop shop that they could come to, form a relationship, feel comfortable, get all of their treatment accomplished in the same central location.
Yeah, in central location, I think that's important to point out. Morgantown is the location, but your service area is quite large, isn't it?
Yeah, what I've found through this that is amazing to me is that people come from, lots of different locations. Southern West Virginia, 2-3 hours away. People come in from Maryland. People come in from Pennsylvania. It's really amazing that the word gets out. You get people's neighbors coming in now to get their treatment accomplished, driving several hours just to find that location where they can feel confident to get the dental work done that they've been fearing and anxious about for all those years.
That's got to be gratifying to you and your staff to know that that reputation that you have of taking care of your patients is drawing them in from all over the place.
Yeah, I mean, I tell my staff all the time that customer service and customer experience are the most important thing. You got to understand, Kevin, these patients are a lot of times terrified. They're anxious. They're afraid of the shame and the guilting of their teeth. And the last thing they want to do is come to a place where they feel uncomfortable. So it's very important if a person is making a decision to go through a treatment that is very difficult for them to go through, that we make everything else about that amazing for them, from the first phone call to the follow-up, throughout the entire procedure. Treating those patients as, that they're important as they are important is very critical.
Yeah, certainly. It's perhaps cliche to say, "Oh, I've got a dentist appointment," but I understand it's not the case with your patients. "Hey, I'm going to see Dr. Dolan and the staff there," and they're excited to come.
Yeah, definitely. I mean, we even like if a patient's coming from several hours away, we'll get them a hotel room and get them dinner the night before so they can come and stay and be comfortable and get up that morning ready to come in and get their treatment accomplished. And it's very important to take care of them in that way.
All right, they're coming from Pittsburgh, though. There's no college football talk, right?
Well, it depends. We try to keep it all hospitable, so yeah, being a Mountaineer fan, we don't like the Pitt fans, but that all goes out the door when they walk in the office for sure.
My daughter's currently a student at Pitt, and she quickly learned that, the Mountaineers and the Panthers do not get along. But that's okay. We're not going to bring that into the office there.
There's no Sweet Caroline or chance in the office. It's okay, sir.
All right, well, let's talk about mini dental implants. And some folks watching, you're probably familiar with regular implants. They've heard of those. So what is the differentiation between a mini dental implant? I would assume size is one of them, but perhaps it's technique too. Can you kind of explain that for us?
Yeah, absolutely. So just basically, a dental implant is an artificial root. It's a tooth replacement. So whether you're missing a single tooth, whether you're missing all of your teeth, you no longer have anything in your mouth that you can anchor or leverage to. The best that we could do in the past, before the technology of implants came along, for somebody that is completely edentulous without teeth, would be a denture, which is just a big plastic plate that relies on suction. And in a person that has their teeth has no comprehension of how difficult it could be to chew and to taste and to feel your food with something in your mouth that is covering so much of your tissues, that takes away all of that tactile sensation and all of the taste buds. So a dental implant is something that just anchors in the bone, that allows you to restore your teeth. And they can be very small, they can be large, they can be short, they can be long, they come in all different shapes and sizes. And the mini dental implants are just an implant that is an option in a patient that has inadequate bone for traditional type implants.
Are they relatively new, to practice?
Yeah, I mean, the mini implants definitely came along after the traditional implants. But as we've seen over time, a lot of the companies that produce the traditional implants are now producing smaller diameter implants, and the companies that produce the mini implants are now producing larger diameter implants. So what we've seen as you know, in the past you had the advocates of the one and the advocates of the other, and now we've just realized that they all work. It's more about the experience and the case selection and the expertise to know when to use which type of implant.
Yeah, that sounds important because, as we mentioned, you are able to do both types of implants and other options for
Mhm.
the patient and the know-how, right? That's important to have. For example, if I want a carpenter to build me a cabinet, I don't want someone who's doing it for the first time. I want someone who knows the type of wood and where to put the nails.
Yeah, I mean, just the journey for me from my first implant place to now, 7, 8,000 implants later, uh, the experience is invaluable. The cases that used to look very complex and uncertain for me, almost now it's just the fun of the challenge of like this patient is miserable with a denture that they can't chew, and they've been told by these other offices there's no options because there's not enough bone. And I take that as like a, hey, let's make this work. And we can make it work, and we do make it work. And it's just amazing to be able to provide that for people that feel hopeless, and to see that, smile on their face when they finally are like, man, I can eat a steak, I can eat apples, I can chew nuts. And it's, even like salads, it's like, here, I want to eat a salad to be able to chew up lettuce. And it's like, we don't know what that is like for a patient. And when they get that back, it's to see them light up, it's just priceless.
Yeah, when you were talking about having a steak or a salad, I was just thinking about, you're talking about the patient who has a denture that's just kind of floating around in there, and we've all seen those folks at times where you can tell the dentures aren't secure in there, and I can't imagine trying to eat normally if you don't have anything anchored.
Yeah, well, like, we go out to eat, right? It's not a big deal for us, and these patients a lot of times just don't do that because they don't want their denture to fall out while they're at a restaurant trying to eat. I mean, how embarrassing would that be to have that solid anchorage of a denture in your mouth through the use of implants, so that you can have that confidence to go out in public again? We get a lot of patients that come in and they have 3 sets of dentures with them from 3 different dentists. I tell them that they think it's just that this magic bullet that they're gonna go to the right dentist and they're gonna get the right type of denture that's gonna work, and it's not the denture, it's just the nature of wearing it. And every once in a while, there is a unicorn that can function with their denture, and the worst is a patient who knows that unicorn because then they expect that that's gonna be their experience. And the truth is for the vast majority of the population, it just will not work due to the anatomy of their mouth, due to their ability to tolerate something like that, due to the type of saliva they have that provides suction. It just doesn't work for a lot of people.
Well, the implants do work for a lot of folks, and imagine the life-changing ability of a mini dental implant. Let's hear from one of Dr. Dolan's patients and how it changed their life.
I came to Mom Dental Associates because I had issues with my teeth to where I had to get teeth extracted. I saw an advertisement with Dr. Dolan that he does partial implants and implants, and so I thought I'd check it out. I wasn't able to smile showing my teeth for a very long time, and I wanted to do something about that. I got the work done, and after several years of not being able to smile, showing my teeth, I finally got my smile back, and I appreciate Dr. Dolan and what he's done for me. Everyone was very kind here, all the workers, everyone, and Dr. Dolan did a remarkable job. Thanks.
Well, Dr. Dolan, I bet it never gets old to hear a satisfied patient.
Yeah, it's amazing. I mean, like I said, every time they come in the office and they're happy, it's really gratifying for me. Nobody gets excited about an amazing extraction or an amazing filling or an amazing root canal. Nobody talks about it, but people will talk about their ability to chew their food again, to smile in public. You see a lot of people that come in and when they first meet me, they kind of cover their face when they smile, and it takes them a while to get comfortable that, hey, I can smile. I have teeth here. They're pretty. They're beautiful.
Yeah.
People like them.
Yeah, the confidence that they get from having a winning smile, if you will. And we have some examples here. So you're going to kind of show us with these models exactly how the implant looks and what it is.
Yeah, absolutely. So like we kind of touched on there, Kevin, implants come in all different shapes and sizes. I tell the patient, leave it to the expert to know the right size implant for the right location, different types of bone, different widths of bone, different depths of bone. But in a patient, let's say, that has some individual missing teeth, Implants can be strategically placed. You're going to have a little portion of that implant that's going to stick up above the gum. The threaded portion of the implant is anchored in the bone, like a root would be, so an artificial root. And then we take a digital scan of this that our trusted lab technicians are going to utilize to create a custom crown that is the tooth portion. So you have the implant that's a root, and then you have the crown that is the tooth portion. Now this is going to be cemented in place. It can be used to place multiple teeth. It can be used in an area where you're missing a single tooth to place a single tooth. And once that cement is, that bonding agent is placed and this is put into the mouth, it is now a fixed restoration. Meaning this is going to be the closest thing that a person could actually get to having a natural tooth that you chew on, directs the forces into the bone, which is where they're supposed to be, instead of on the opposing teeth. And it's also going to be the most easy to clean and brush and floss around.
So important things here. You can match the color of their teeth, correct?
Yes, absolutely.
All right, so that's certainly important because folks might wonder, wow, am I going to get this super white tooth in there?
Duh.
Well, maybe get all your teeth whitened out when you get it done, but it can match the natural color of your teeth, how they currently are. That removes right there, but that's not how it is in the mouth. This is just for model's sake.
Yeah, absolutely. I mean, I could make the tooth look however they wanted. I've been waiting on that one patient to do a gold grill, but it hasn't happened yet. But maybe someday we'll get there. But yeah, we're going to pick a shade that precisely matches, and the lab technicians that are very experienced are going to shade and shape and mold that tooth in a way that kind of blends seamlessly into the arch. So the goal is once that's cemented in place and the patient smiles, even the patient themselves is not really going to be able to pick out, oh, that's the implant tooth. Because I could tell patients the last thing you want is when you go out, people are like, your teeth look nice. It's like, hey, you look good. Something's different about you. What has changed? Because we want that to just look natural and kind of blend in and not stand out. I mean, we've probably all seen those patients that have cosmetic restorations that look fake and everybody knows it's fake. And that's the last thing we want. It's like, oh, wow, your teeth, So we just want hey, you look really good. What's changed?
With the single tooth or a couple of teeth in this model example, what's the maintenance like? Do you brush normally? Is there any special flossing you need?
Yeah, absolutely. So a little different in the sense, like if you do a stretch of teeth, they're kind of connected. So a water pick is an essential tool to learn to use. Brushing and flossing are always going to be essential. There's nothing that is maintenance free in the mouth. The mouth is a very traumatic environment with bacteria, moisture, saliva, biting forces, hots and colds. Everything requires maintenance. So there's I no longer have to take care of anything. All requires maintenance. Brushing, flossing, water picks, just like a little pressure washer for the mouth. So for any fixed restoration, those are really nice to kind of flush under. These are going to fit really snug to the gums, but little bugs and bacteria can still, get underneath there. And the water pick is a nice, effective way to kind of flush that out and keep that area healthy and clean.
I like that phrase. There's nothing maintenance-free about the mouth. That's something certainly to remember.
Absolutely.
For everybody watching out there.
Yeah.
All right. There's probably somebody watching right now says, well, that's great, but I have a full upper denture. What can you do for me?
Yeah, absolutely. So if a patient has struggled with their denture for years and years, you're going to have a couple of options. And this would also suffice for someone who maybe knows that their teeth are in really poor condition and it's time to take the proverbial plunge to removing their teeth. And I will say, Kevin, we never take that lightly. It is a big life-changing event. It can be very traumatic for someone to accept the fact that all of their teeth need to be removed. So we want to make sure that that is the only option if we're going to do that, because that is not an easy process to go through. It's our job to be there to hold their hand and walk them through it. But whether it be a patient that needs all of their teeth removed or a patient that has dentures that they've struggled with for years, whether it be a gag reflex, won't stay in, there's no suction, it floats around, my gums are always sore. We can actually utilize implants as a way to kind of anchor and leverage that denture in place. So the implants are strategically placed throughout the arch, and this is just a demonstration model. You could still have a denture, which is essentially an acrylic appliance, and the implant has a little male ball attachment on the top, and the denture has a little female O-ring inside of it that actually provides a little snap-in retention. So now you no longer have to rely on suction. When you're biting, the forces are going in the bone, which is the way God created it to be, and not pushing on the gum. And also you can cut a lot of the additional acrylic away from the roof of the mouth and things of that nature, so you don't get the gag reflex. And you may not realize, because a lot of people feel the tongue is where the taste buds are, people will rave about how much more they can taste their food when they have less footprint of material in their mouth. Now I can actually taste things more, which wouldn't be something that most people would know, that the roof of the mouth is very important for tasting your food.
Probably improves speech also, I imagine.
Yes, it is a little change. So obviously not having the roof of the mouth covered kind of allows more free roam for the tongue in the mouth. But if you've had a denture for years and all of a sudden the palate is removed, it is going to be a little adaptation to the talking. I remember when my son was young and got a palatal expander, he was really lispy. And then when he had it removed, he was really lispy again. And it takes a little while for the tongue to kind of train to the new patterns and the new surface area in the mouth, for sure.
This in particular, this denture type of implant. Now, we talked about the single tooth and the brushing and the water pick. Same maintenance here, or is it a little different?
So the implant denture is still a removable appliance.
Okay.
I tell the patients there's still a lot of coverage of the gingiva with the pink acrylic. So this is important to take out on a regular basis, just like a denture would be removed, cleaned. The implants would be brushed and cleaned, and then the denture placed back in. So, a lot of patients are like, do I have to leave it out all night? And absolutely not. A lot of these people, the last thing they want to do is have to leave their teeth out ever. So take it out, clean it, put it back in the mouth. You're good to go out in public restaurant, things of that nature. So
I bet that it's life-changing for someone who has worn dentures, wants the denture. I guess my question for this is, what differentiates to do that as opposed to, I'm sure can you put mini dental implants for every tooth?
yeah, absolutely. So, the best option, the most desirable option, obviously, which is going to be based on available bone, would be something that is, it's for all intents and purposes for the patient, it's fixed. I call it semi-removable because I like the peace of mind of knowing that in the office we can remove the appliance. So let me talk about the appliance a little bit, and then I'll talk about the semi-removable nature.
Sure.
So essentially, this is something that you would place an implant for basically every root that you're replacing. And this is more the material that crowns would be made out of. It's called zirconia. It's a harder material. It looks like porcelain, but it's very durable. And this is something that would be placed in the mouth, and you can see that there is very minimal coverage of the gum tissue. This is going to feel more natural. This is going to allow you to chew much more effectively. And this is going to be something the patient is going to use a power toothbrush, mouth rinse, a water pick to kind of flush around. But we still bring our clients in every 6 months for hygiene. Even with the removable denture, we still want to bring them in, clean around the implants, make sure we get all the tartar and bacteria off, make sure the implants are healthy. So I like to make this in what's called a semi-removable fashion, and actually it will snap in place and be very secure for the patient. But when you come in, we will remove it. Our hygienist will clean around the implants, make sure everything's healthy, and then we will place it back in your mouth, and you will leave, and for 6 months you'll leave it in. And the analogy I use is, you don't make a car without a hood that you can lift if you need to get to the engine. So the last thing you want to do is to cement this in the mouth permanently, and then down the road several years, maybe a piece of a popcorn kernel or food gets stuck underneath it. Maybe the gums get irritated. It's much more simplistic to have the peace of mind of knowing we can just take the appliance out and put it back in. So that provides a lot of comfort for the patient to know that it can be removed if need be.
And as you're saying, the 6 months, that's kind of the normal visit cycle anyways, isn't it?
Yeah, absolutely. So, like we tell our patients, nothing is maintenance free, and it's also still important that you come to see us on a regular basis. So 6 months is a good guideline. There are some patients that have excellent home care that we'll bring in once a year, and there are some patients that need to come in a little more often just because the composition of their saliva promotes more buildup, more tartar, things of that nature. So it's all kind of a case-by-case selection.
And so the difference between this option, what you said is more ideal, I think, as a practitioner for a patient who needs all their teeth removed. The difference is bone structure that they have available?
Yeah, a couple different things. So you can kind of see how much more the removable implant denture covers. So if we have a patient come in that struggled with dentures for years, this option is going to be a big game changer for them. And this option is going to be even more amazing. If we have a patient that comes in with all of their natural teeth, let's say 30s, 40s, 50s, 60s, they've spent their whole life with real teeth in their mouth, it's going to be very difficult to transition to anything that is removable that covers more tissue. So for a patient that comes in with all of their natural teeth, to be able to transition straight to this, which we can do immediately, we can have something temporarily made the day their teeth come out, the day the implants are placed, the same day, they will leave with something attached to those implants that is fixed in place. And you can just imagine how amazing it is to have that immediately in place rather than having to struggle with a denture for 6 months while their bone heals. So,
Yeah, that does sound amazing. And we're going to talk about the options perhaps for you and how you can find out which solution is perhaps right for you in your own mouth. But right now, let's hear about some more satisfied patients with their life-changing implants.
I had gone to 3 other dentists that had told me I only had 2 options. I'd had a history of bad teeth. Going to see Dr. Dolin, I didn't realize I had a 3rd option. And I liked the 3rd option, which was implant retained dentures. I was always told implants or dentures, you can go, but this was a happy medium, and I liked the idea that I had a 3rd option. We went through all the options, pricing, and all of that. After we went through all that, I met with Dr. Dolin, got the feel for him, and I said, you know what, this is my new dentist. This is who I want to go to. I was afraid to smile before because I had all sorts of issues with my teeth, but now I'm happy to smile. And I would recommend anybody that has any kind of dental issues, come see Dr. Dolin. You'll be happy you did.
It's always great to hear those life-changing stories. And Dr. Dolin, I'm sure some folks are watching saying, okay, I want my life to change like that. The best way to do it is call for a consultation. Numbers on the screen, but they should call, make that phone call, right?
yeah, absolutely. We know this is a big move for you, right? We know that it's scary. It's the right move to make. You call in, we'll take care of everything. We have a dedicated implant coordinator that will take your call. And this is the person that's going to be your concierge, so to speak. So this implant coordinator is going to build the rapport with you over the phone, get to know you a little bit, schedule your appointment, bring you in for the free consultation. It's always free. The consult's free. The x-rays are free. The examination is free. We're going to bring you in, chat with you, get some images on you, talk with you a little bit. And then at that point, I will come into the room to present your options.
I know they'll be told this when they make a phone call and talk to your implant coordinator, that concierge kind of service, which is sounds fabulous, probably differentiates your practice from other ones, perhaps in the area. Are there certain questions or materials that they should be prepared to talk about, perhaps bring to the appointment?
Yeah, we will answer all those questions, Kevin. And we want to make this as easy as you can, so you don't have to worry about anything. We're going to take care of telling you what to bring, what to be prepared for. We often request or suggest that you bring a family member along.
Sure.
When we present a lot of information, it's hard to remember all of that, and it's good to have another decision maker with you to kind of help you through the process. But we want to keep it kind of as simple as possible for you.
Yeah, it's a good idea to bring somebody with you too, because perhaps they notice things that you might not have thought of or written down. I just know that when I go to an appointment with my kids, like, well, what they're not telling you is this, or I'm looking forward to you helping my spouse out or mom and dad out here to kind of improve their life.
Yeah, absolutely. Well, if you're like me, you only remember about a third of what you hear. So it's good to have somebody else to remember that other third. But yeah, we want to make sure when you leave the office after that consultation that you have every question answered, that you have every treatment option presented, that you know everything you need to know to make an educated decision, an educated choice on what is the best option for your oral health. And we also want to make sure that all of the financial and the other questions are covered as well, so that you know exactly what to expect. Transparency is key. The last thing we want is for anything unexpected to pop up. It doesn't do any good for us and our reputation or for the patient. So we want to be as transparent as possible on what to expect during this whole procedure.
All right, so while you're watching the show out there, take out your phone, take a snapshot of the screen with that phone number on there. Nobody jots down phone numbers anymore, but we take screenshots of the phone number there, or just mark right now. You can Google it, Morgantown Center for Mini Dental Implants. When they come for the consultation, they look to move forward for the procedure. One of the things you're going to talk about with the patients is the financing options and insurance. Those things are all discussed, aren't they?
Absolutely. Yeah, a lot of patients will call in ahead of time and they say, how much does this cost? And it's very difficult to speak to that until you see the patient and you see their circumstances, much like remodeling a home. You can't call a contractor and say, hey, before you come out here, how much is it going to cost to remodel the home? They have to see everything first and lay out the options, and we will be certain to answer those before you leave. So after I come into the room to talk with you about your options, the implant coordinator has a dedicated office that's nice and comfortable to take you out of the clinical area where a lot of people have anxiety, take you back, seat you, chat with you about the different financing options, chat with you about how insurance is involved and how we handle that. All of those questions are going to be answered so that when you walk out of there, there's nothing that is uncertain. Everything is going to be very clear and apparent as to what you need to do.
You know, a couple things that I think have resonated with me throughout this program and talking to you today is you're very aware of the anxiety that the patients may have and the potential outcomes for them that's going to change their life. And these are all factors that you've taken into great consideration when working with your patients.
Yeah, we understand a very big decision, and we do not take that lightly. It's not lost on us at all. The customer service aspect is very important from start to finish. We know that when you come and make this decision to change your life, that there is a lot of anxiety and fear there. So we want to make every part of every part of the process that surrounds that procedure as easy and comfortable and amazing for you as we possibly can. And I tell my staff every day that the customer service experience is the most important thing, that we take care of our patients and that we don't let our patients down.
And that continues after the procedure.
Absolutely. Yeah, the implant coordinator is kind of the phone a friend at any point of the day and night that you need to send a message or a phone call. They have a dedicated cell phone that is available because, the last thing you want is to have a huge procedure done and to go home and it be a Friday evening and there's a problem or, a pain or a discomfort you're feeling or something go wrong that you're not sure what to do about and to feel lost and to feel abandoned. So we want to make sure that we have somebody available there to help you through the whole process, to keep you feeling comfortable and safe through the whole procedure.
Yeah, it certainly makes sense. And to use your analogy again with the home improvement project, anybody out there, you've had a home improvement project done afterwards, like, why did I wait so long to redo our kitchen? I bet you have a lot of patients tell you, why did I wait so long to get this implant?
Yeah, absolutely. I mean, the process can, take a little time and can be a little tedious to get from point A to point B. I often tell patients, I wish I had a magic wand that I could wave and everything would just immediately be perfect. But we want to be there to get them through the bumps and the valleys, to get them to the final product where they can smile, where they can chew their food, where they can go out in public, and where they can be healthy again.
I just get the sense, talking to you here in the program, that that's how you treat every patient with every dental procedure, from a cleaning to a tooth extraction to a mini dental implant.
Yeah, I'm glad that you sense that, Kevin. That really is important to me. It's very important to me when I get referrals from other doctors, when I get referrals from patients from their neighbors, because they say this is the place to go to get your work done, because that is the kind of reputation that we strive as the Morgantown Center for Mini Dental Implants to have.
All right, what great information on mini dental implants. Doctor, thanks so much for joining us today.
Thank you so much for having me, Kevin.
All right, thank you for learning more about mini dental implants, and thank you for watching Trending Health. We'll see you next time.